Designing an unfolding case study.
Hi, my name is Tracy Chapman, and I am a DNP student at Weaver State University in Utah.
Hi, I'm Jason Blomquist, and I'm a DNP candidate at Boise State University School of Nursing. In addition to our roles as students and faculty members, Tracy and I both work with this amazing and innovative team at the Simulation Center at Boise State. Through these experiences, we've found and strive for making really, truly authentic and engaging experiences for our students. And we wanted to be part of the Digital Innovators program in order to learn new skills and to understand how we could better incorporate some of the tools that Apple offers into our teaching.
Early into my undergraduate teaching career, I was working with behavioral health students, and we had to switch from teaching regular NCLEX style questions to NCLEX next-gen questions. I integrated some resources from the textbook that I was using, and I developed a series of unfolding case studies that we built into the learning management system, and they were quiz style. They were kind of bulky to work with, and the students would have to come get a piece of paper from me to move on through the case study. After running the unfolding case studies for a couple of semesters, Jason and I decided that the Digital Innovators program would be a really good way to solve our problem. We want students to have exposure to these next-gen style questions and get comfortable with unfolding case studies, and we just needed a better way to do it. So we've been collaborating and practicing for the last 6 months, and we've been able to come up with a really cool prototype. After a couple of meetings with our mentors, we settled on using Apple numbers as the backdrop for our prototype. So you can see on this page, we want students to underline or highlight the important cues that they see or that they heard from report. That's a component of the new next-gen questions, that they will be highlighting information. They can also jot down their thoughts about what their initial thoughts are. What do they want to know about the patient? And then they'll move on to the next page. Once the students have worked all the way through the unfolding case study, they're asked to record an SBAR report to an oncoming nurse, and that just summarizes what they did throughout the whole case study, and can they verbalize and tell us what they did. It's a really great learning tool, and it gives them an opportunity to practice being succinct and giving a nice SBAR.
Our presentation is Digital Pedagogy to teach psychiatric nurse practitioner students and midwifery students about perinatal mental health conditions. Hi, my name is Amy Go, and I am a PhD candidate at Boston College. My dissertation research examines digital health equity in pregnant people of color. I've been a midwife for the past 10 years. I'm currently practicing per diem at Boston Medical Center. I'm also adjunct faculty at Thomas Jefferson University, which offers a distance midwifery program. I've been teaching primarily antepartum for the past several years. I also currently work as a digital health coach for OVIA pregnancy, fertility, and parenting apps.
Hi, my name is Danielle Walker, and here is a little bit about me. I am a PhD candidate at Boston College, and my research is focused on community violence exposure and the impact it has in Black emerging adults with psychotic disorders. I work as a psychiatric nurse practitioner at Boston Medical Center and also do some side work at a private practice. For the last year, I've worked as an instructor at the MGH Institute of Health Professions, teaching psychopharmacology and also child and adolescent mental health. And it's been a great experience thus far.
We were interested in the Digital Innovators program to gain skills in digital pedagogy as both instructors and PhD candidates. We started our doctoral program at Boston College during the pandemic, and we noticed our university made rapid changes to accommodate remote learning. Though we had our learning management system in place prior to the pandemic, there were some areas of virtual learning that were lacking in stimulating our interest. As the next generation of nurse educators, we are passionate about engaging students from all backgrounds and learning abilities. 1 in 5 pregnant and birthing people in the United States will develop a perinatal mental health condition. Due to our clinical backgrounds and shortage of mental health providers for birthing people, particularly those with Medicaid as seen from this map, we wanted our lesson to focus on how to improve patient-provider communication in people with perinatal mental health conditions.
We decided to use 2 different Apple solutions to solve our problem. The first one we decided to use was GarageBand. Then we also wanted to use clips. Students would create a podcast in GarageBand describing perinatal health conditions using evidence-based information. And in the podcast, we really hope they include the definition, the signs and symptoms of the mental health condition, how to diagnose, and also how to treat the conditions. Using the Clips app, we will have the students role play where one student is the provider and the other student is the client with the perinatal health condition. If you go to our EPUB, you can find the link to our lesson plan to how to fully create these projects. In it, you'll find some learning goals and how we feel the technology can really aid in teaching our students about perinatal mental health. We hope you like our project.
Welcome to a quick look at our Digital Innovators experience. My name is Amy Fresh and my partner is Nicole Schumacher. We are both neurovascular nurse practitioners as well as second-year PhD students at the University of Tennessee Health Science Center. Let us first discuss why we decided to apply to the program. Nicole and I both wanted to learn about new and innovative ways to engage learners. Our goal was to create interactive educational materials to encourage active participation of students during the learning process. We also wanted to be able to reach a large audience with the content we create. What better way to accomplish that goal than by learning from experts in both education and technology? Our core audience for this learning activity was intensive care nurses caring for complex stroke patients. Aneurysmal subarachnoid hemorrhage was an easy choice as this patient population is a small percentage of stroke patients, making this patient type a low-volume, high-risk patient. Annual education within the hospital typically consists of short learning modules that do not require much thought and lots of clicking for the nursing staff. Nurses consistently indicate they do not usually get a lot out of these modules. We decided to create an interactive multimedia learning activity that would encourage interaction and participation by the nursing staff. So what was our solution? Nicole and I decided to create a presentation that could be turned into an EPUB within Pages. The presentation includes videos, engaging pictures, and stop points to assess for learning throughout the activity instead of only completing a post-test at the end of the module. When completed utilizing an iPad, the learner can also utilize the Apple Pencil to create visual notes as they learn new content to assist with retention. It's important to be creative and use interesting pictures that clearly depict what you're trying to showcase for the learner. What we have found especially useful in stroke education is utilizing real-world 3D imaging from prior patients. We also incorporated short videos that were concise and easy to digest. When the videos are too long or complex, the learners begin to tune out and miss information. We also encourage the use of checkpoints throughout the learning activity so that the learner has to stop and check in, demonstrating retention of the information presented. How can you start and utilize this type of educational experience in your world? When creating content for nurses, it is highly recommended that the nursing staff be engaged in choosing what content would be most beneficial for their needs. Another great idea in the hospital setting is to speak with the nursing educators and programmatic leadership. Find out where there are deficiencies and need for performance improvement and use that information to help guide choices and development of educational activities that will be beneficial to the nursing staff and the patients. We want to incorporate clinical practice guidelines to align the education provided with the program the education is intended to support. Utilize Pages to create a multimedia interactive educational activity and include checkpoints to track learning throughout the module.
Hello, my name is Jennifer Duggar. I'm a PhD student from Texas Women's University, located in Houston, Texas. I am an instructor in an undergraduate nursing program, and I specialize in simulation creation and instruction.
Hi, my name is Rachel Krogsty. I'm a PhD student at Texas Women's University in Houston, Texas, and I'm an instructor and simulation specialist at a BSN program in Pearland, Texas.
This generation of nursing students is accustomed to, and oftentimes actually prefer, to receive their educational content digitally. The reason we decided to join the Digital Innovators program was to improve our ability to offer enhanced and engaging digital material to our students, as we were both used to assigning traditional handwritten or word processing assignments. As simulation educators, we were interested in making the simulation experience more collaborative and student-led using these digital tools. There are often times when students participate as passive observers during a portion of the simulation experience. During this time, we found that students were much less engaged than during their time as active simulation participants. Additionally, we found that pre-brief and debrief were often instructor-led, and that students tended to only focus on their own performance during debrief. So we asked ourselves, how can we make these pieces of the simulation experience more collaborative, engaging, and student-led?
The Apple solution that we chose in order to address our issue was numbers to begin with. So what we chose was to have an iPad or an iPad mini available for the students with a numbers document that they can share either for their personal devices or one provided to them. And throughout the simulation, they could follow along on a living, breathing document to document through all the phases of simulation. The students start off on a very simple page for their pre-briefing. It has their assigned groups and demographic information for their patient. It also has other paperwork that they would need to fill out, such as a fall risk or an S-bar for anything else that they would need, introducing themselves to this patient before the simulation starts. As the simulation starts, the observation group follows the activities of the simulation, writing comments for review. The participants then have an opportunity to respond to these comments during the debriefing time. Finally, during debriefing, the facilitator walks the students through a series of questions, and the students have a chance to reflect on this documentation. Then, this document itself can be saved for future reflection, whether that's in the classroom or individual student reflection.
Hi, my name is Wendy Hammond, and I am a registered nurse with my bachelor's degree. I attend the University of South Florida, completing a concurrent degree of Master's in Public Health and Adult Primary Care Nurse Practitioner. I chose to be a part of the Digital Innovators program because one of my career goals is to be an adjunct faculty member, and I can learn how to use technology to enhance students' learning experiences.
Hello everyone, my name is Victoria Jordan Smith. I am a DNP student in Nursing Administration attending Sanford University in Birmingham, Alabama. I was fortunate to attend the GNSA conference last year, and after witnessing the Digital Innovators Project, I was inspired. I knew it was something that I wanted to do. I immediately inquired about how to get into the program.
The teaching learning problem we are solving is to bridge the generational gap between nursing students and the elderly.
The Apple solution we selected is the Clips app and the Notability app. Our students will use the Clips app to record an oral history interview of an elderly person. After the interview, they're going to use the Notability template provided to present a history of the person that they interviewed. Here is our notability template that the students will use to present their elderly person that they interviewed. We want the students to be creative and have fun with this project. We want them to add pictures and videos. There were certain areas that were left blank intentionally to increase the students' creativity when they're telling their person's story.
So thank you from Victoria and myself. And we encourage you to download our book and open it up to our EPUB chapter. Thank you very much.
Hi, I'm Dr. Colleen Seabrook-Holmes, and I'm a recent DNP graduate from Temple University's College of Public Health.
Hello, my name is Dr. Deepali Malter, and I'm also a recent DNP graduate from Temple University College of Public Health.
The title of our Digital Innovator project is Creating Innovative Opportunities for Learning Using GarageBand. The problem that we would like to solve is giving students another forum for demonstrating and knowledge and for sharing expertise. So instead of having sort of a traditional term paper or even a discussion board, students can have a more creative outlet for demonstrating their knowledge and expertise.
Our Apple solution is applying GarageBand, which is a digital program that they can use to record books and a podcast to show their expertise on a particular subject. Welcome to episode 14 of What's New in Nursing Education. I'm your host, Deepali Malter, and today I'm joined by Colleen Seabrook-Holmes, who's going to talk us a little bit about the NCLEX changes. For those of you who are not familiar, NCLEX stands for the National Council Licensure Examination. The NCLEX is the final step in the academic process to becoming a nurse. In April 2023, the NCLEX called Next Generation NCLEX, or NextGen, was released. Colleen, in April, just to prepare their students for the exam, faculty went crazy trying to scramble to understand what these changes are and what they mean. Can you tell me a little bit about the changes?
Thanks, Deepali. Before I talk about what's different, let me tell you what stayed the same. So for those of you familiar with the traditional examination, you know that it's a 5-hour adaptive examination, meaning that the test adapts to the test taker's ability. In other words, the test delivers the next item or set of items depending on the correctness of the test taker's response to the most recent items delivered. NCLEX NextGen is no different. It's still a 5-hour adaptive examination. However, the types of questions are different.
Well, that wraps up episode 14 of What's New in Nursing Education. I want to thank Colleen for coming in and sharing her expertise with us. I'm your host, Deepali Malter, and tune in next week for episode 15 when we talk about instructor burnout.
Hi, my name is Jessica Gomez. Paige Owen and I are PhD candidates at the Cizik School of Nursing at the University of Texas in Houston. We paired up to join the Digital Innovators program through Apple and GNSA to learn about Apple solutions to improving health and nurse education.
Jessica and I decided to participate in the GNSA Digital Innovators Program because we wanted to sharpen our educational skills and learn how to use technology to make clinical learning fun, inclusive, interactive, and accessible.
In our experience, we have found effective feedback to be an important learning and teaching tool. However, feedback is often not provided in a helpful manner, or it's not well received.
We used Pages to create an EPUB to be able to teach learners about giving and receiving feedback in the clinical setting. We used funny TikTok videos and incorporated things to increase engagement and make the learning fun.
In Pages, we created our EPUB that explained how feedback works and what the purpose is, as well as add an opportunity for them to learn about what kind of feedback style they use and what are the pros and cons of each style.
At the end of the EPUB, we provide learners the opportunity to put that learning into action through the use of an interactive case study featuring fun memojis. Learners have the ability to meet Jeff, a coworker, and provide feedback to Jeff based on what they've learned so far. Learners can submit their feedback using a recorded audio, a video, drawing, or even text. Jess and I are super excited that we were able to use the tools learned from the Digital Innovators Program to create this EPUB coming soon.
Hi, my name is Rachel Bloodworth, and I am a PhD student in the joint PhD Nursing Science program between the University of Alabama in Huntsville and the University of Alabama. I am also a nursing instructor at Northeast Alabama Community College, and I'm also the second level clinical coordinator. I am always looking for innovative ideas in engaging our students in the clinical setting. This Digital Innovators program has provided me multiple ideas on how to do that, and our project actually utilizes different methods of engaging our students in the clinical setting.
Hello, my name is Amanda Nance, and I'm from Tuscaloosa, Alabama, and I am a PhD student in the joint program as well with Rachel at the University of Alabama and the University of Alabama in Huntsville. And I'm so excited to be doing this program. I'm also a nursing instructor at the University of Alabama, and when me and Rachel got together, we were talking about the biggest struggles we have as clinical faculty, which is with our students and engaging them with our post-conference and engaging them within clinical. And so that was our number one goal, was to find a way to innovate and change the post-conference setting. In the past, students have spent hours and hours doing clinical paperwork and just transcribing their patients' lab values and assessment findings on a piece of paper that they don't really even link to anything else. This generation is big in technology. We are missing something huge if we're not using technology in clinical as well. So when we brainstormed together, we decided to create a template for something for clinical instructors to be able to customize and use for their own good, and it'll also help these students in their theory portion as well. This is a quick view of our Pages template that we created. I will go a little bit in further detail in just a second, but this is just a great way to innovate. We first selected a concept of the week, so that way the students can pick a diagnosis or a problem to further their knowledge on and build all of these wonderful things through technology. This is an example of utilizing a blank page on your iPad to further expand upon a problem or a diagnosis. As you can see here, I used the pencil, I used pictures, I used also that bottom left is a video from YouTube, and when you click it, it takes you directly to YouTube to watch a video on hypertension. This is just a great way for students to use their creativity to also help with their cognitive thinking and connecting things from clinical into theory. This is another component we added, which is the SBAR form for giving a report or calling a physician. And this just gives a visual way to start systematically thinking about how to give a report to ensure you don't miss any vital information. The last piece we utilized is reflection. It has been proven that reflection is big in clinical settings, and this is a way for them to just have prompted questions to answer, whether it be just simple as what went good today and what didn't go good. And that way they can reflect on how their day went and how to improve. Our favorite part of this project is the fact that it's completely customizable to anyone in any way possible. It could be changed over courses, different types of courses, and that way it just allows the clinical instructor to connect theory a little bit better to their clinical setting and help that critical thinking component.
Hello everyone, my name is Nara La Tortue. I am a registered nurse and a graduate student at Kennesaw State University. I'm getting my master's in nurse education leadership in a digital world. In my program, I've learned so much about how technology can supplement the student learning experiences, but also guide the educator on how to teach topics. I wanted to keep a pulse on things even after I graduate, which is what attracted me to applying to the GNSA program. I decided to use the knowledge that I learned in this program for my practicum that I did over the summer. I was part of adult health nursing, and I had to educate students on oncology nursing. Essentially, it was 3 topics: introduction to oncology, epidemiology of cancer, and blood administration. I'd used Pages to create these 3 modules, and I also use PowerPoint because I have to take into consideration the students and the ones who don't have Apple products. I can't wait for you to see what I've done, and I hope you guys use it in your practice. It doesn't have to be just for oncology, but it could be for anything else. Thank you again for listening in. I provided 3 lectures into these modules. I did an introduction to oncology basics, which was about cancer pathogenesis, how it presents in the patient, signs and symptoms of oncology, management of oncology patients, and the treatment plans associated in oncology. I also provided epidemiology of cancers, such as breast, colon, and lung cancer. My last lecture was about blood administration and how nurses must follow protocol for blood administration. I did this within 2 hours and 45 minutes. And this included the active learning activities such as the case study and the Kahoot session. I was nervous, but I got it done. Well, there you have it. 3 lectures, a case study, and a Kahoot session in 2 hours and 45 minutes. If you didn't think that sounded daunting, imagine how I was feeling. I could have pulled my hair or removed my glasses. Just kidding. I was very happy to get it done, though. I had a great time, and thank you for listening in.
Hi, my name is Sarah Delgado. I graduated from the University of California, Los Angeles in June 2023 with a doctorate in nursing practice. My experience includes working as an acute care nurse practitioner, as a nursing faculty member, and currently for a professional nursing organization. I'm proud to be part of GNSA's Digital Innovators Program.
Hi, my name is Karina Menjivar, and like Sarah, I am a class of 2023 DMP graduate from UCLA. My background is in healthcare leadership and nursing administration, and I too am excited to be part of the Digital Innovators Program.
The problem our project addresses is homogeneity in the nursing profession. We know we can improve patient care and increase our workforce capacity if we do a better job of attracting and engaging people who identify as men and people of color in the nursing profession.
Through the Digital Innovators Program, we learned to use many Apple solutions. But our project focus was on the use of sketch notes to plan, Pages to offer a template for submissions, and Clips for video recording.
In step 1 of our project, participants will contribute their stories via text or video using a Pages template. In the next slides, you will see the templates for the text and video versions. Both versions include open-ended questions to inspire story development. Once we have 10 stories, we'll move on to step 2, creating the EPUB. Karina will describe that next.
Seeking to inspire others to imagine the possibilities, our finished product would look something like this: a compilation of stories from men and people of color pursuing their nursing profession. Through this publication, people can watch a video of Raymond's story, or read of Janet's story, who was inspired to return for a second career into nursing.
To conclude, there are many factors that contribute to homogeneity in nursing, and solving that problem will require comprehensive change and multiple solutions. What we propose here is one very small step that leverages the skills and knowledge we gained in the GNSA Innovators Program. Thank you.
Hi, I'm Ronnie.
And I'm Rebecca.
We are PhD candidates at Northeastern University in Boston. I wanted to join the Digital Innovators program because it is a nice way to learn about how to use technology into the classroom. When I was in undergrad and I had to go to a 3-hour lecture with a professor talking at us with a wordy PowerPoint, it was hard to stay focused and learn. So hearing of this program where I can learn about technology in the classroom was very interesting.
And along the same lines, students now and future students are using technology. And as a future professor, I really wanted to learn everything that my students already know and learn how to incorporate that technology into the classroom.
The current statistics show that 70% of college students with disabilities do not actually disclose their disability to their professors.
For our project, we really wanted to bring awareness to nursing professors on how they can use technology in the classroom to help manage and work with students and their disabilities. So after a brainstorming session on sketchnoting, we came up with the idea to make an EPUB for nursing professors so that they can better understand Apple's accessibility features, and then they can incorporate those into their lessons so that they can meet the learning needs of their students. Hey there, and now we have just a couple of clips for you to give you an example of how this might look in the classroom.
Getting ready for the new semester. Let me see who I have in class. Oh, I see this one says they have a visual impairment. I wonder what I have to do to accommodate them so they can participate and learn the material in the class. I think I'm gonna email my Disability Student Services department and ask them what I can do. Oh, that was nice and fast. Oh, and there's an EPUB that lays out the features to incorporate students with visual impairments by using Apple technology. Cool, let me read this EPUB and incorporate these into my lessons.
Okay.
Getting ready for a new semester. Let's see who I have in class. Oh, this one says they have a hearing impairment. I guess I'll just give them all the lecture information in the textbook.
Hi, Professor. Can I connect my Bluetooth hearing aids to the classroom iPad so I can hear the lecture?
What? What do you mean? How do you do that?
I do it with my iPad all the time.
Okay, sure.
Okay, thanks so much. I can show you. Hi, Professor. I had difficulty with the first lecture, so I found this EPUB online that explains how to use accessible technology from Apple. Would you mind taking a look at it?
Sure, I can take a look at it.
Thanks so much.
Hello everyone, my name is Heather Lashley, and I'm a PhD candidate from the University of Maryland School of Nursing. I've been at University of Maryland, Baltimore for a couple of years and have learned a lot about accessibility and disparities in healthcare, and have also seen different issues within classroom settings. The Digital Innovators Program encouraged me to consider content accessibility in education. The program also helped show the benefits of using Apple products in education.
Hi everyone, my name is Erica Ventura Castellon. I am a PhD student at the University of Maryland, Baltimore, and I decided to participate in the Digital Innovators program to learn about tools that can be used and implemented in my future endeavors as an educator. And one of the big problems that we identified together with my teammate and classmate is sometimes the lack of a user-friendly guide around reference managers. And we sometimes as students were presented with different tools that can be used, and there are different ways of learning how to use the tools or the programs that are presented to us. We wanted to develop a accessible and user-friendly guide to make this to streamline this process for future students, so that potentially other students wouldn't feel as overwhelmed or stuck when they were presented with different reference manager options. And we decided to use Zotero because it seems like an accessible platform, and so we developed a video with how to use it and like a quick step-by-step general overview of this program.
Welcome to the video presentation for my Digital Innovators project. My name is Kendra Lopes, and I joined the GNSA Digital Innovators program as a DNP student at the University of Washington, Seattle. I'm now a board-certified family nurse practitioner, and I will soon be practicing primary care at a federally qualified health center in rural coastal Washington state. I've also been hired into an adjunct faculty role. I was inspired to participate in the Digital Innovators program through GNSA because I saw a real disconnect between the digital knowledge and abilities of incoming students and the faculty that teach them. As a future nurse faculty, I wanted to learn methods of integrating technology into my teaching. I also wanted to ensure that my teaching methods were engaging and that they met the needs of students given how rapidly healthcare is changing. My psychiatric nursing professor during my BSN program once said something that I've never forgotten. Every patient is a psych patient. As I've gained experience in nursing, I've also realized that every single patient encounter involves moral and ethical dimensions. My main teaching interest is medical ethics. As a trained clinical bioethicist, I am particularly interested in training healthcare students and workers in practical approaches to analyzing challenging ethical situations. Nurses face increasingly challenging ethical situations during each workday. Just like a rudder helps to stabilize a boat or a plane, I think about ethics education as providing a moral rudder that helps steer nurses and other healthcare workers through challenging decisions. Modern ethical issues in healthcare include abortion, patient confidentiality, drug shortages and rationing, privacy, life-sustaining technologies, brain death, healthcare justice and equity, transplant tourism, the refusal of care, gender-affirming care, healthcare worker well-being, assisted reproductive technologies, death with dignity, rescue medicine, and even medical cannabis. Ethical issues related to research include access to research studies and protocols, representation of subjects, the risk of harm involved, informed consent, bias, anonymity and confidentiality, the potential for coercion, and whether or not someone should be paid for their involvement. The question of whether healthcare is a right or a privilege is an ethical question. Other important and timely bioethical issues include discrimination, gun control, the emotional and physical safety of healthcare workers, healthcare disparities, and workforce diversity and representation. We are bombarded with ethical issues and cases every day without much training in understanding and analyzing them. My solution was to engage students in analyzing challenging real-life bioethics cases from the popular media and sharing their finding in a comprehensive, creative way using an Apple Pages template. As an example, the heartbreaking case of Terry Schiavo and the media circus that ensued loomed large over my childhood and helped to inspire my interest in medical ethics when I was just a kid. The components of this project are a case introduction, a timeline of the events, defining medical, legal, and ethics terminology, listing the ethical issues involved, stating the primary ethical question in the case, making a list of stakeholders, listing relevant laws and policies, describing the outcome of the case, performing an ethical analysis using the 4 ethical principles, and comparing the case to a similar case, describing how they are similar and different. Students are expected to list 2 references, one from the popular media and one from an academic journal. My EPUB has a link to an example of this project analyzing the case of Terry Schiavo. Thank you for watching my presentation.